Welcome to the podcast, Lauren. I'm really excited to chat today.
Thanks, Leah. I'm so excited to be here. I feel like this has been a long time coming, so I'm glad we're here today.
Yes, me too. Well, I love to start with hearing a little bit about you and your personal story with food and body. As much as you're comfortable getting into, I find it just gives nice context for how you're arriving to this work and the conversation.
Sure. Yeah. Well, I will say I have unearned thin privilege. I have always been in a smaller body, and I have two kids who are also in smaller bodies. So I have never personally had to navigate the world feeling the weight discrimination. Um, I was born in the 70s, so grew up in the 70s and 80s. So was certainly had a household that was like steep in diet foods. I can't believe it's not butter spray and fat-free, sugar-free frozen yogurt and the snack ball cookies. And it was just somewhat of part of just how we grew up. My mom, who, like all moms, are really well-meaning and would talk about her weight a lot. We had a scale right there in the bathroom that I was home recently in April, and I'm like, I think that might be the same
It's
scale.
like
Must
dusty.
be
Yeah.
dusty and old. Um, I was lucky to somehow escape without ever having an eating disorder, but my sister struggled for most of her life with disordered eating. And I first really knew about like how terrible an eating disorder could look like through my cousin, who was, kind of my person when the family was really close in age and just had a terrible eating disorder through most of her adolescence. And so I was just really seeing the ways in which she was missing out on so many family events and meals and activities and joy. So it was really kind of learned about it through her and through them.
Yeah. And what brought you to this work? You now work with adolescents and young adults. Is that the official tagline?
It is.
With disordered eating, eating disorders as a focus. How did you go from seeing this in your family system, but not struggling with it personally, to one day deciding to do it to serve this population professionally?
So my cousin, to be honest, the person who saved her life was an adolescent medicine specialist. And I didn't know about what adolescent medicine was at that time. I just knew she had this doctor who was incredible. And because we're a really small field, actually, I've since met this person, which is kind of cool.
Oh,
But the adolescent medicine is not many people know about it. There's like three age-based medical specialties. So we have neonatology for babies and gerontology for older adults, and adolescent medicine is for teens. And really, there's so many things I love about it. To be honest, it feels like the best kept secret in medicine. But one of the areas that I think is just so much fun to be part of is the fact that adolescents are the organically most medically healthy age group,
mm,
and they have so much morbidity and mortality that is behavior based
mhm.
and that we can actually modify and support them with. So when I was in medical school, initially I was actually thinking I was going to be doing OBGYN because I was really interested in women's health. And then I learned about adolescent health more from an advisor in the idea of like, oh, I could kind of approach this from a preventative lens
Mm,
and really think about ways in which we can prevent these things as opposed to kind of coming at it from the other way.
mhm.
But I would say eating disorder specifically as a doctor, the first time I really had um, my first experience up close with a patient, I was in my pediatric residency. I was at Brown and I was in the ICU. And the intensive care unit was not where I would normally imagine I would meet my first eating disorder patient,
Mhm.
but that's where I met her. And she was a college student and she had a heart rate of 22
Mm.
and she had liver failure and she had had a seizure from hyponatremia from water loading and had had multiple bone breaks and ended up needing to be medically conserved. And so I think I was able to see like, okay, this is a group where actually has significant medical complications where we need to kind of be able to understand that and understand the complexity of it, but also, gosh, if there's ways in which we can prevent it, wouldn't that be something that would be meaningful for me in terms of my career?
Yeah, wow. I'm just thinking about my listeners hearing this and being like, yeah, because I feel like my listeners tend to be more like disordered eating versus eating disorder. I think they can fall into that trap of like, oh, well, like I don't have a heart rate of 22 and I'm not in the ICU. Can you talk a little bit about maybe perhaps like the slippery slope of disordered eating to eating disorder?
Yes. And to be honest, that's why I wanted to share that story
Yeah.
because I know the listeners and I know so much of the work that you do. And, I do think sometimes when we talk about dieting or we're talking about GLP-1s or we're talking about these choices, I think sometimes we forget just the slippery slope, as you said, and how quickly people can become so medically compromised. So I guess one thing I would say is, what I think a lot about when we think about diets and weight loss is weight suppression, right? So when we think about this um, from a diet perspective or from a GLP-1 perspective, like weight suppression is actually seen as like a sign of success. So it's the difference between your highest weight and then the weight that you currently have and how much weight you've lost. And that can sometimes be seen as somewhat of a marker of health. And yet for patients with eating disorders, what we know about weight suppression is that actually more weight suppressed you are, the worse your medical complications are, and the quicker and sicker you can get. And so, I think it certainly is, as you said, a slippery slope. I mean, I have yet to meet somebody who wants to have an eating disorder.
Yeah.
I just don't think that that is the case. Nobody wants this. And it is so unpredictable in the ways in which the brain can be vulnerable and the ways in which the brain switches. And we just don't know when that's going to happen. We just don't know how weight suppressed you are until these things start to happen. Um, but what we do know, especially for young adults and adolescents, is that this is a time of tremendous growth and development. And so this is a time where your body is supposed to be shifting and changing and developing, and those things require a tremendous amount of nutrition. And so when that is low, everything can get negatively impacted.
Yeah, I also just think about like even if it never progresses from disorder eating to a clinical eating disorder, disorder eating still is it negatively impacts the quality of your life and your happiness and maybe your heart rate isn't that low and you're not having like such like acute medical complications, but still the long-term effects of weight cycling and of like restriction you might not see them immediately, but it doesn't mean that it's not negatively impacting your body.
Absolutely. And I'm glad you brought up the heart rate because that's something that I hear about a lot and we talk about a lot, especially when we're starting to kind of push nutrition, where people will often say, like, well, my heart rate's okay, or that the heart rate improved. So isn't that enough? Isn't it okay because my vital signs have improved? And what we know are that the vital signs are vital. The body is going to do everything it can to first protect that. And that does not mean that the body is well
Yeah,
even if those markers look okay, even
right.
if the labs look okay, the labs usually do look okay.
Mhm.
Often the vital signs are okay because the body does everything it can to protect itself, and it really tries to compensate and to try to support itself. And to your point, that does not mean that you are living a life that is anywhere near free of the trap and the prison of just the disordered eating.
Yeah. Okay, so I want to get some just like quick facts that I have spoken about before, but I think people value hearing a doctor's perspective. So, we talk a lot about the dangers of dieting and why intentional weight loss most of the time is not sustainable long term. Can you talk a little bit about what's happening metabolically, physiologically, to explain why intentional weight loss is very rarely sustainable long term?
Yeah, so certainly from a medical perspective, weight loss always carries some real risk. The body is so reliant on good nutrition. And so when we are just kind of taking that away and cutting that out, the body is going to then perceive itself to be starved. And then it goes into this protective mode where it is going to be trying to just save itself. And so, it will just quickly downregulate everything, right? And so the brain, which is a large part of the brain is fat. And so when we lose weight, we actually lose brain tissue. And, we've done MRIs where we've looked at people who are um, have an eating disorder and have lost weight from the eating disorder, and their brain is actually like filled with the ventricles are larger, which is just fluid,
Mm,
as opposed to when we can get them weight restored and the brain is just like nice and filled with its fat-filled brain.
mhm,
But what that does, of course, is it makes concentration harder and attention harder. And we see worse mood lability. We
mhm,
see worse verbal scores and math scores. When the body, it's literally every single organ system. And I'll often go through it with young people just because I think we sometimes glaze over that and don't realize, gosh, it impacts every single organ system.
mhm.
So I will talk about the teeth. That is one of the areas where I think most young people really don't love that part just because it's irreversible in terms of the impact on the teeth. Is
Yeah.
any sort of purging, even if it's not happening regularly, right? That can erode the enamel on your teeth, and that's irreversible. We certainly see the impact on the heart, where, and I'll hear often, well, my heart rate's low because I'm an athlete, but an athletic heart, the heart muscle is thickened as opposed to a um, malnourished heart where it's just a weakened, thinner, less functional heart muscle.
Mm,
We certainly see the bone risks. And this is something that like broke my heart, to be honest, last week because I was talking to my cousin who had had her eating disorder as a young person, and she is now doing well. She's now weight restored. And she said, why have I had three stress fractures in the last 3 months, even though my bones are supposedly okay now? And it is like, oh, but during that young adult time when you're building that micro architecture of your bones and building the bone density, like that is so nutritionally dependent. Um, and then the immune function, I think that's something else that we'll see a lot is for young people who are like, oh, I just keep getting sick. I keep getting, just not feeling well,
mm,
because their body is just completely immune suppressed. And then we certainly see like the iron and the vitamin D becoming deficient. Um, and, I just also, I don't know how many of your listeners, Leah, are assigned male at birth,
mhm.
but that's an area too where I am just, I gave a talk last week and a mom came up to me afterwards and said, oh, good. I don't have to worry about this because I have sons. And I'm like, oh, you
Yeah.
really do. You really
Oh,
do.
yeah.
And so really, I've also just seen like the impact it does to testosterone and sexual health and, um, Yeah, it's just there's not an organ system that gets spared, unfortunately, with eating disorders.
Mm, yeah. And I mean, I've worked with men and they have a lot of the same pressures. It's just, I think, not as spoken about as often. But for someone listening who's like, okay, but I'm already grown, so like maybe I have a little bit more room to be risky with restriction, what would you say to that person?
So, I mean, I think what we know is that well, many things. I think for one, I think that what the challenge with restriction is it's not sustainable, right? The body isn't going to allow that to be a sustainable eating pattern. And so, what we see very frequently, and I know that you work with very frequently, is that the fact that the restriction is just setting people up to, your blood sugar is going to drop. We're going to have the shifts in the energy and in the blood sugar. And then you're really often they're setting people up to just feel out of control around food
Mm.
and to then set up themselves up for a binge and to then kind of cycle through. And this is this area where I have really been just trying to sit with patients and just say, it makes sense, right? Like it makes sense. And like to not feel critical of yourself for trying that, and of course it makes sense that this is not going to be a sustainable pattern because the body is not going to be able to sustain just that ongoing restriction. Um, and then, still, even if you're just restricting here and there, even if we aren't seeing the numbers impacted, we certainly see the impact in terms of mood, and we certainly see the impact in terms of rigidity and the ways in which just the mental real estate can be completely overtaken by food, by even that like sub level of starvation.
Right. I just think about how smart the body is, even just saying, oh, I can only have like this many carbs, or this food group is not allowed, or no added sugar, whatever rule that might seem like pretty benign compared to like something that's, more extreme. The brain is so good at predicting and trying to protect us. So it's like, oh, okay, well, there's some amount of restriction going on here. We have to make sure we can get our needs met, drive up thoughts about food and, desire to seek out energy dense foods, which is calorie dense foods. Um, and yeah, I love the reframe of like, this isn't a flaw. This isn't your body betraying you. It's actually really smart and really good at trying to protect you.
Totally, totally. I'll often help family members or loved ones of the person who's kind of in this cycle, help them appreciate what this feels like when I will say, okay, or I'll say this to residents if I'm giving a talk, like, let's say today we thought lunch was getting delivered at lunch, for this conference, and it never comes. And you're all just sort of sitting there like, where the hell is the lunch? Like
Yeah.
just irritated and a little like just can't get settled. And then it's all you're thinking about. Like for that entire lecture, like, where is my lunch? How am I going to get through the afternoon? And like to feel that at a chronic level, to feel that of like what that is on a day to day to day basis,
Yeah.
like just the impact of that. And this is going a little bit beyond, I'm taking us on a little bit of a tangent, but I see that too with like the athletes where, there might be that one day where, okay, maybe you did a lot of movement and didn't fuel appropriately. But when that happens at that chronic level, that's where we start to see, the psychological impacts, but that's when we also really start to see those medical impacts.
Yeah, I love that visual that you give the residents. It makes me think about when you're out to eat with people and you've arrived to the restaurant too hungry. You've miscalculated and then the food is taking a while and it's like you're trying to focus on the conversation, but you're kind of darting around looking like, where is this waiter or waitress right now? I need the food and you can't really enjoy because you're too hungry and you're too fixated.
Of course, it makes sense,
Yeah.
right?
Yeah.
Yeah. Yeah.
I want to talk a little bit about GLP-1s, but first, I'm genuinely so curious. so far how you've shared your story, it's like, got interested in eating disorders and then you went on to do this like amazing, powerful work. I'm curious, did you have to do unlearning from the mainstream, like weight normative approach to healthcare that I imagine you encountered in medical school?
Yes. I think the unlearning was done through the teachers of my patients.
Mm.
So I, certainly learned, and I will say, I think it was my first day of medical school. The dean said to us, um, 50% of what you learn in medical school will later be disproven. And the dilemma is we don't know which 50% it is. And, I think it was such an important thing to tell us so that it could allow us to know like we have our limitations and we're going to be continuing to learn. And so we have to stay open. And and so that has been, just a useful tool for me to remember of like, okay, that was just part of what we were taught then, and now we know better.
Right.
And so we have to evolve. But it was really, I think when I was initially really working with patients with eating disorders, it was also working with them, again, this is years ago. So under kind of the myth of what eating disorders looked like. I was I came out to California to do my adolescent medicine fellowship, and I came out with the idea like this is just going to be seeing the rich young white girls from Marin. Like that's who I'm going to be taking care of. And within the 3 years of my fellowship, I really saw like, oh, that's actually not what this looks like at all. And so I think that was the first thing I needed to learn was that eating disorders look like we don't know how they look. Like we can't have those sort of
Yeah.
stereotypes or we're going to completely mishandle so many young people. And so I think that was the first lesson. And then the second lesson was just really seeing patient after patient who had been in a larger body and then had somebody say something to them, or they just breathed the air of our culture. And then they were getting really so much positive reinforcement and were presenting much later than someone in a smaller body because of the health system not screening them and because they thought they were doing what we asked them to do and showing up just so sick of like, this is not okay. We have to do better.
Yeah, that piece breaks my heart of what would be caught or registered as an eating disorder in a person in a smaller body goes undiagnosed in someone in a larger body because they're doing what they're told that what like the medical system, the mainstream medical system teaches of like, oh, good for you, you're being vigilant and disciplined. But if that person was in a smaller body, how quickly the red flags would be raised of their, restricting and overexercising and, you know, losing a bunch of weight. Like that's concerning. Um, yeah, it's
I'm like feeling a physical reaction as you're saying this, Leah, because I'm remembering this boy in my clinic years ago who had been just had endured so much bullying through his life. And he lost like 50 pounds in
oh,
3 months. I mean, he was so medically compromised. And I had to hospitalize him. And in the hospital, when we were talking about him needing to gain weight, he said to me, you telling me this feels like you're literally spitting in my face
oh.
because you are trying to give me the same like you're going to be pushing me to go back to all that bullying and
Mhm.
I am trying to fight out of that bullying and like just how that feels of like the trauma on both sides, the trauma of the bullying and then the trauma of the weight stigma of the healthcare system. And it is just so difficult for young people.
That story is heartbreaking. And I hope that human got good support of like unlearning this idea that like the bullies are going to bully even if you gain weight. I mean, of course, it's valid that that was connected to your weight, but
Yeah.
that sounds like it would have been a journey to unlearn.
Unlearn.
Yeah.
Yeah.
Okay, let's talk a little bit of GLP-1s. I feel like I
You
feel
take a
my
deep breath
no,
as you
I
go.
literally feel my it's like I'm having my notes up and I'm like, yeah, one more question before we get there. Because it's just such a drag, but
I
it's
know.
so important. Um, Tell me about what you're seeing in the adolescent population in terms of like the impact of GLP-1s on teens and young adults with eating disorders. Um, and sort of as like a part two to that question, also I'm curious about social media's impact. And
Mm.
this feels like a big Venn diagram because I don't know, personally, yeah, my social media is serving me ads for weight loss drugs that I don't even have to go to a doctor for, that I could just go to this website and get. So yeah, what are you seeing right now?
So, um, certainly what we are seeing is that prescriptions of GLP-1s for young people have skyrocketed. The A study published in 2024 found that it had increased 600%. 600% between 2020 and 2023. So you can just imagine what's happened post 2023, just because it feels like it's just continues to increase. Um, but I guess what I would say that has been really important in what I am hearing is that young people will say to me, I actually never, I actually had gotten to a place where I wasn't worried about my weight and I was feeling good. And then I saw it in my fridge. And so there was another family member who was using it, or I just found out my sister's using it. I just hearing my mom talk about it.
Mm.
And so I think that is the part that is really concerning. Our teens, our young people, they're so smart and they are listening and they are hearing what we are talking about. And so I think what happens sometimes as parents is we'll think, okay, well, maybe this is a decision I'll make for me, even though I know, like, I don't think that'll happen for them and they're not going to
Yeah.
have to worry about that. But they're the modeling of just the message of like, maybe a higher weight is not okay.
Yep.
And that normalizing weight loss is what the teens are really absorbing. And so are coming to me with questions about
Mm.
that I have never really had before. I'll also share that I saw a patient who it was the dad who went to the pediatrician to say, I want my kid to start on a GLP-1.
Mm.
And I think the pediatrician felt a little bit bullied, a little bit pressured, and just started them on it. And the teen lost significant weight and was quite disappointed when she came to me with her eating disorder as a result of the GLP-1. But what she was really disappointed about was like, I thought I would feel better about my body. I
Mm.
thought I would feel better about my mood, and in fact, it's worse. And so I think that's the piece that um, is certainly what I'm seeing and what I'm feeling. And then I guess what I would say from a more academic perspective and what is just making colleagues of mine being like, wait, what is happening? Is the fact that this is happening despite just so little research, like so little data. And that we are often, it seems like these things that are used in adults are just being extrapolated for kids as opposed to looking at the data that we don't have and looking at the long-term data of adolescents and looking at the fact that we don't have any data on what is safe weight loss during development. Like we don't know that. And so I think that's the piece that just I'm feeling an urge to encourage caution
Yeah.
and encourage us to just take a deep breath and be really thoughtful about what we're messaging and how we're messaging it.
Yeah. Yeah. I mean, I for so long been saying as part of like the kind of informed consent spiel to clients, like we don't know the long-term impacts. But I'm starting to be like, and I can't speak for adolescents, but I'm starting to be like, wait, we kind of do. Like it's been years now since this has been out. People who go off them regain the weight. I mean, that's like that's not like super long term, but I'm starting to be like, no, we kind of do. Like people, we are seeing people go on and off them and what happens. But obviously that's not like, 5+ years of data. What if a patient comes to you and is interested in a GLP-1 and shares that, what does informed consent look like in your practice and with your patients for you?
So, well, first, what I would say when it comes to minors is we have to think about consent and assent, right? Like, so consent is for the parents who are giving permission for their child to have this, but assent is for the adolescent to really understand what are the risks and the benefits of this. And I think in my experience, I don't think that is happening fully. I think it is sometimes being kind of quickly discussed with the parents, and then maybe the adolescent isn't completely hearing all of it. Um, I will say I am really trying to appreciate nuance in medicine because I think that is an area that medicine can sometimes be really black and white. And I think we have to just name the fact that we don't know exactly what everyone should do. Like we just don't. And so I really am trying to understand people's goals. I also will say I have the privilege for many of my patients to work with a team. And so I will say, like, we can talk about some of the medical harms. We can talk about what we know, what we don't know. Certainly, the treatment endpoint is one of these really a big black box. Like, when are we stopping? What does that look like? And what does it look like of like if that if those symptoms get worse? Like, what does it look like if your eating disorder, if you suddenly have an emergence of an eating disorder?
Mm,
I think certainly what we know is people who have a history of an eating disorder or vulnerability to an eating disorder really should not be started on a GLP-1. And I don't think we're doing really great screening to understand who those people are.
mm,
So I would say I don't think I necessarily have a script,
yeah.
but I do have the privilege of time of trying to really understand what people's goals are and helping them understand what this might look like for them and thinking through with them of what do we do when these symptoms are going to be coming up? What would it feel like if we stopped it and wait, you gained weight because you're supposed to, because you're still growing.
Mm,
What does that feel like? So I think it's trying to have as many thoughtful conversations so that young people don't feel like they're alone and they're navigating this alone and they are needing to just make a decision. And because I think I worry that they're going to do it. If they're going to do it, I want to be thoughtful and collaborative
right.
and
Reminds me of like abstinence education in school. It's like, okay, well now they have no education on when they do have sex because they will, how to do it safely. Though I guess it's not an exact comparison because it's like, how do you do a GLP-1 safely? Um, yeah, what do you think about that?
you know, I haven't seen it. I've haven't seen it personally be done safely in terms of patients I have been who have been referred to me
Right.
or patients I have seen. I have had a couple of anecdotes from colleagues of stories where, at a very low dose in these circumstances with a thoughtful team, with a collaborative approach, they have seen some benefits. And again, kind of what benefits are we talking about? But I do think, um, there's probably more nuance to it than
Hmm.
we know yet.
Yeah. Yeah. Yeah, I appreciate you saying that because definitely like it's my instinct to come down really hard on GLP-1 just because it's been so upsetting to see the way that
I
they like
know.
set us back in terms of how we feel about weight loss and the necessity of weight loss and beauty ideals and all that. And yeah, there's so many human beings and so many it's still so new. So I think yeah, it's like hard for me to say, but it's helpful to keep in mind that we just don't know. It could be supportive in some world for some person in some dose without causing an eating disorder, but that's not us like advertising that you should try.
No, 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 no. And I appreciate the feeling that you're having in your body as you're
Yeah.
talking about this. 'Cause I can feel it from you, and I feel that the same. And so I continue to kind of like, okay, just try to be open and try to learn and try to keep learning. And I think what you and I are feeling too is it's hard to have the conversation or to see it presented without a world where that doesn't perpetuate weight stigma,
Right.
which we know has its own health harms. And so, I think it's a constant balance of like, what are the risks and what are the benefits here, and which we do a lot in medicine, of like, okay, there's the pros and there's the cons, and how do we have thoughtful discussions, knowing like this is your life and these are your decisions, and I can't make that decision for you. I also have patients in much larger bodies who will tell me the story of like, you know what, I used to ski and I can't go on the chairlift
Mhm.
anymore because of my body size, and I want to go on the damn chairlift. And this is the decision that really matters for me. And I think I also have to just question like, who am I to make that decision for them if we can continually be kind of yeah, just continuing to think through like how this is going to feel for you in your experience.
Totally, totally. One of my best friends, I lived with her when I was living in Brooklyn, and she actually has been on the podcast. Her episode is the most downloaded episode. I had a really like important experience where she decided to go on a GLP-1. It was in my fridge in her apartment in Brooklyn, and this was the early days, like when it was just becoming a thing that people knew what those words, what those letters meant. And she's lived in a larger body most of her life. And, it was similar kinds of things. Like, I want to be able to bike around the city and like do different activities and that it feels like my body is limiting me from right now. And I really had a moment of like, how could I understand like what that feels like I just don't. And it was very important for me. I mean, she ultimately decided herself to go off because she started to realize like she took it once a week on Sunday and she started to realize as Sunday got closer, she felt hungrier and hungrier and more out of control around food. And she's very smart. She's like, how will I feel when I go off this? And I don't want that urgency and those binging feelings to come flooding in and lead to weight cycling, and she knows about all that, so she was like, nah, I'm not doing this. But yeah, I can appreciate who are we to make the call for someone else of like if this feels like an important thing to at least try. It's hard to argue, people have body autonomy.
I know. And I will say in this young person that I sort of mentioned, it was it was kind of as a team because we had a team, and there were people on the team who said, I can't care for her anymore if she starts on this. And,
Mm,
I felt like, well, she needs
right.
us, right? And they were able to kind of come around, and then we started her on it because that was really what she was advocating for herself, and like, okay, this is what it's going to look like. And then she said, you know what? I feel like an eating disorder voice is getting much louder.
Oh, yeah.
And she was like, That's not okay." And I
Yeah.
was just so impressed with the way in which she was able to listen to that and be honest with that.
Yeah.
And so able to like, okay, this is actually not working for me and for my
Right.
brain chemistry and for my body. And so, how do we guys kind of continue to think it through together?
But she decided for herself instead of
Yeah.
feeling that lack of autonomy. It reminds me in the work I do with clients of like giving unconditional permission to eat. And then they're like, wait, actually, I don't want to finish that whole thing of Oreos. But because I'm allowed, because my autonomy isn't being threatened, and
Yes.
it's just sort of it's an irony of like, and it's not to say that happens to everyone, but I think that it's such an important thing, like to recognize the instinct to rebel when you're being told everywhere, don't do this, don't do this, don't do this, versus having like a more harm reduction approach that it sounds like was the case with this patient of like, okay, this is really important to you. I'm hearing that. Like, okay, like let's talk about it.
Yeah, yeah, exactly.
Okay. Can we hear a little bit about your upcoming book before we close out here? You shared a little bit about it before we hit record. Can you tell us what it's about and sort of what you're hoping to accomplish with it?
Yes. So I'll tell you about the patient that kind of inspired me to write this
I would
book.
love that.
So I saw a patient, and it was actually, I think it was just the fact that it was like patient after patient after patient, but it was this one particular patient that I think was sort of like the straw that broke the camel's back that came to see me for an eating disorder. And she's really clearly could articulate to me when she decided to start to lose weight. And she describes it having been like at the pediatrician's office, and the pediatrician pointed out her growth curve and said, okay, this is a problem. And she went home and she cut out sugar, she cut out carbs, and she quickly became weight suppressed. She shifted her movement, started her, she got really sick really quickly.
Mhm.
And she came to see me, and she was telling me this story. I said to her, well, and I kind of told her the story about what my dean told me. That's how we were taught in medicine. But actually, like now we know a lot of other things, and that the weight actually isn't an indicator of your health. And I said, like, that's not okay.
Yeah.
What happened to you is not okay. And she was this really thoughtful adolescent. And the next time I went to see her, she came to see me, excuse me. She had, in the interim, been to her pediatrician for her younger brother who needed a checkup. And she pulled the pediatrician aside and she said, I just want you to know that what you said to me before was not okay.
Oh.
And she said to me, I was like, oh my gosh, that's amazing. And she said, she got really defensive. And she really just kind of doubled down. And I was like, okay, I think we need some scripts because I know these doctors and I know how thoughtful they are. And I know that they are well-meaning. And it's also really hard to say as a doctor, like, I made a mistake, right? We worry about the liability of all of that. And we've been sort of taught to be fearful of making mistakes and or that we're supposed to be perfect. And so I really just initially set out to write this book as a guide for clinicians of how to have these really tricky conversations around weight and body in a way that is useful, and harm reduction and how to repair. But then in the course of it, I live in Northern California like you, and I have two kids who are in school and a pretty progressive school. And I was seeing them coming home, having learned about all the injustices in the world and the way in which to be inclusive, and realizing, hold on, like weight discrimination is not being talked about. Like, why are you not learning about that in school when it is the number one of them, if not the number one cause of discrimination for kids and bullying for kids? And so I really was like, oh, we got to include the schools in this book of like, how do they have these conversations in PE and in health class? Like, why are they learning about sugar
Yeah.
and not learning about eating disorders? Why are they learning about social media and how to be really savvy and critical of it?
Right.
And then for parents too. And so I really it's a practical guide. It's called Freeing Children and Young Adults from Shame, Scales, and Stigma. and it's a practical guide for parents and teachers and clinicians. It's a very long title, but
Yes.
you know what you're
And there's some
getting.
alliteration, shame, scales, and stigma. I love it.
You know what you're getting. It's coming out in March and it's supposed to be useful. I'm an impatient reader. I'm like, tell me what to know. So it's
Yes.
supposed to be kind of scratching that itch of like, here's a script, here's some tips, here's ways to just implement it.
I love it. It sounds like it's filling such a gap. Because yeah, obviously there's tons of stories of I mean, I read mostly, I'm looking at my bookshelf here, like dietitians writing about intuitive eating, health at every size, weight stigma, even like the racist roots of fat phobia, like this kind of stuff. How to raise an intuitive eater, but clinician to clinician or clinician to like education system and clinician to parents, it sounds like such an important piece of the puzzle to manage eating disorders, weight stigma, and I'm so glad that you wrote this book.
Thank you.
Yay. I can't wait to read it. I can't wait to add it to my little stack over here.
Oh,
Okay, so there's two questions I like to ask everyone. The first is, as you know, I am an intuitive eating dietitian, and I got really interested in the word intuition because I think it's so loaded, and so many of us intuitive eating providers just kind of throw it around. And so I'm wondering if you are comfortable sharing, what does intuition mean to you, and how do you experience it?
such a good question. Such a good question. I think intuition is a is an experience in the body. And for me, it is, I can't listen to my intuition if my brain is chattering. And so I think in order to feel into my intuition, I need to also slow down and work on being quiet, even though I think that's sometimes really hard. Um, I will also say, and sorry if I'm going off subject, but this is just like what's coming up for me when you're asking this question is, I in starting my private practice, it was like kind of getting off this 8-lane highway of big healthcare to do it. And it felt really, really scary. And I think it was almost like I started to listen to this voice in me. And the more I listened, the louder it got. And
Mhm.
it just got louder and louder and louder to the point where I was like, okay, well, I have no choice. I have to do this. And so I think the more we can quiet and the more we can listen, like that intuition just grows and grows and grows.
Yes. And I also think it's a positive feedback loop. Like when you listen, it feels so good and you want to listen more.
Yes, yes,
I
yes.
love that. I often say this to clients, like, they start listening to their body's cues for hunger and fullness, and then they're suddenly like, oh, like my body's telling me other things about like, ooh, I don't feel good when I hang out with this person, or like this job doesn't feel right, or it's like you can't put the toothpaste back in the tube once you establish that connection or reconnect, because we're born that way, and then diet culture and all kinds of societal things disconnect us. It's like you can't just cherry pick and be like, just talk to me about food, please. It's gonna give you other information.
Totally. And I think for some people, it doesn't land when we say like love your body. Like that just feels a little weird or abstract. But when we can say listen to it, like listening to it is something like we know our ears work and we know that we can kind of tune in to the sensations of it and yeah, I think just feeling like we can listen to it and we can respect it is just a much different way of tuning in.
I love it. The other question I ask everyone is, what is your current biggest diet culture pet peeve?
Where do we start?
I know.
I guess I would say as a doctor, I have a really hard time with the misuse of the word health. Um,
Not what I expected you to say, but go ahead.
So, I think where health is just being thrown around. In many ways it feels like it's like a rebrand of a diet is now we're calling it health. And and then when we dig in and I'm like, okay, so this path or this, you know, message that you're getting in regards to health is leaving you exhausted
Yes.
and disconnected and hungry and worn out. Like that just can't be health. And so I think we just really want to make sure that we are being really clear that health are things that are going to be supportive of somebody's energy and somebody's joy
Yeah.
and somebody's well-being and their ability to connect. And that's the other piece is when you're starving, you're not going to be connecting with people. And we know that that is healthy for people to
Yes.
be in connection. And so I think I have a real hard time with the word health. I'll tell the story at my book club a couple weeks ago. Somebody had mentioned a GLP-1 and I really was trying to be really quiet about my physical feelings and emotions around it. And they said, yeah, well, I know it's going to be like the future. It's just, there's so many ways in which it's going to be um, healthy for so many areas. And then I said, what about the joy? Like, and they said, oh, well, no, no, no. I mean, there's no joy in with the GLP-1. There's no joy in eating, and there's no actual joy in connection or sex or living. And I'm like, well, how is that healthy? How are we? So I think we just really have to be sure I guess that's my pet peeve. Sorry. My
No,
pet
I
peeve is the
love
misuse
this.
of the word health.
I love this so much. Are you familiar with Taylor Swift at all? I mean,
Oh,
who?
yeah. Excuse me. I'm an
Yeah,
adolescent doctor
yeah.
to teenage
Okay,
kids.
true, true, true. Okay. So, oh, what a dumb question. Are you familiar with Taylor Swift? So, I love doing this activity with clients. It's just cute. I mean, even if they're not familiar with Taylor Swift or like a Swiftie, more like everyone's familiar with her, where we write health and then we write in parentheses diet culture's version or like, mainstream version, how it's like Taylor's version. And then another line, it's health and it's like Lauren's version in
Yeah,
parentheses. And just seeing them side by side is often so helpful for them to be like, okay, diet culture's version is like all about looks. You could be miserable and feel awful and low energy inside, but if you look toned, if you have like a Pilates body and your skin is clear and you're eating green things and whatever, then you must be healthy. Um, versus usually their version is like, yeah, their relationships be feeling fulfilling, feeling joy, being able to eat the things they like without feeling obsessed or out of control. And I just love that exercise because I think about how it's also so relative. Like I love that you put it in terms of things that bring you joy and that like increase your energy and support you. But I also think about how like for some people, certain things are part of their definition of health that aren't for others. And if you're striving after a definition that isn't true to you, then you might achieve that and be like, well, I still don't feel healthy. I still don't feel good.
completely, completely. And I feel like maybe that is the question when it comes to GLP-1s is like, how do you want to feel?
Yeah. And be really honest with yourself.
Be really honest with yourself.
Yeah.
Yeah.
Yeah. Is there anything else you're feeling called to share? Anything on your heart that would help this conversation feel complete?
That's a great question. Well, I guess the I feel like I have to say is that I know we're talking about said adolescents and young adults, and when I started my career, we saw adolescence as kind of going down to like age 10 or 11, kind of like when around puberty. And as I've been more and more specialized in eating disorders, I have just also appreciated how much younger
Mm.
my practice needs to go. And so I am, seeing a 6-year-old right now. And um, I had a 20-year-old who said to me I said, when did you first started struggling with your body? And she said, when I was in kindergarten. And so I just think we have to recognize like these really, really, really young kids are listening and just how to be really thoughtful as parents, as adults in the world of like just these young ears that are absorbing these messages about body sizes.
I really appreciate you adding that. Are you familiar with Girls on the Run?
Yes.
I have coached Girls on the Run for many seasons, and a couple seasons ago, I think it was a third grader, which like hearing a 6-year-old, I'm like, oh wow, that's like actually not even that young. But to me, I was like, oh my gosh, we brought snacks to practice. It was like a special, practice 5K and whatever. And I overheard one of the girls say to the other, well, I'm not eating the snacks. I'm just drinking the water because I want to be healthy. And I was like,
Oh,
yeah. And of course I'm like, well, you need to run, you need fuel to run. And but it's just sometimes so hard because I'm like, I can say this thing that will maybe plant the seed, but they got that from somewhere. It's going on at home or somewhere else. So yeah, it breaks my heart how young these things are learned. And I think the reminder that kids are really smart and they're listening is so important.
yeah. Yeah.
Okay, where can people learn more about your work and stay connected with you?
Probably my website is the most comprehensive. So it's Aspen Grove, AYAM, so Aspen Grove Adolescent Young Adult Medicine.com. Also, I have since started Instagram like 2 months ago. So that's Lauren Hartman, MD,
Okay.
on Instagram.
I'll put both of those in the show notes
Great.
and keep an eye out for Lauren's book. This will probably come out before it's out, but I can't wait for that. Thank you so much for sharing your wisdom with us, Lauren, and coming on the show.
Thank you so much, Leah. This was lots of fun.
Yay.